Urine albumin, the early warning sign before your GFR plummets. Many of you wake up every morning and notice a slight puffiness around your eyelids, a lingering fatigue that coffee cannot fix, or perhaps you see a strange foam in the toilet that lingers long after you have flushed. You might even feel a dull heaviness in your lower back or notice that your blood pressure is higher than it was just a few months ago. It is so common to dismiss these experiences as just another part of getting older, but I am here to tell you that these are not just harmless signs of aging. These are the frantic SOS signals of a kidney under extreme stress. They are often the first outward indicators of rising creatinine, a dangerously dropping GFR, and the heavy accumulation of metabolic toxins that occurred while you were sleeping. I am Dr. Matthias from Kidney Health 365. One of the most heartbreaking mistakes I see in modern medicine is that doctors often tell patients their GFR is fine only for that patient to end up in a crisis a year later. They tell you to drink water and eat less salt, but they completely ignore the microscopic leak happening in your filters right now. A major study following over 3,000 adults revealed that an increase in urine albumin can predict a future collapse in kidney function up to 5 years before the GFR even begins to budge. If you ignore this leak, you are essentially watching your kidney health pour down the drain without a plan. The fear of the unknown is real, but there is a powerful window of opportunity here. While a drop in GFR is hard to reverse, catching an albumin leak early gives you the chance to patch the holes in your filters before the damage becomes permanent. There are simple, specific morning adjustments that can stop this leakage and stabilize your internal filtration system. The very first step involves understanding a biological process that happens in your bathroom every single morning, and it is the key to knowing exactly how much time your kidneys have left. Let us look at what albumin actually is and why its presence in your urine is the ultimate wake-up call for your health. To understand why albumin is the most important warning sign in your lab reports, you first need to visualize how your kidneys actually function. Think of each of your kidneys as a massive filtration plant containing about 1 million tiny cleaning units called nephrons. At the heart of each nephron is a microscopic filter known as the glomerulus. In a healthy body, this filter acts like an incredibly fine coffee strainer. It is designed to let water and small waste products pass through into the urine, while keeping large essential molecules, like albumin, safely in your bloodstream. Albumin is a vital protein often compared to the white of an egg that keeps fluid from leaking out of your blood vessels into your tissues. It is a building block for your muscles and a carrier for your hormones. Under normal conditions, the holes in your glomerular filter are far too small for a large albumin molecule to fit through. However, when the kidneys are under attack from high blood pressure or elevated blood sugar, the delicate walls of these filters become stretched and damaged. They begin to develop microscopic holes. When this happens, albumin starts to slip through the sieve and ends up in your urine. This condition is known as albuminuria. It is essentially a leak in your biological plumbing. According to the National Institute of Diabetes and Digestive and Kidney Diseases, seeing even a small amount of albumin in the urine is one of the earliest signs of kidney damage, especially for those managing diabetes or hypertension. The danger of this leak is twofold. First, losing albumin weakens your body and causes fluid to build up in your legs and face, leading to the swelling many of you experience. Second, and more importantly, the presence of albumin in the urine is toxic to the rest of the kidney's drainage system. As this protein travels through the delicate tubules of the kidney, it triggers inflammation and scarring. This means that an albumin leak is not just a symptom of damage, it is actually a driver of further destruction. If you catch this leak while it is still in the microalbuminuria stage, you have a much higher chance of stopping the progression. But many people make the mistake of ignoring this because their GFR still looks normal on paper. Let us dive into why relying solely on your GFR score can be a dangerous trap that leaves you vulnerable to a sudden health collapse. Waiting for your GFR to drop before taking action is one of the most dangerous gambles you can make with your health. Many patients are lulled into a false sense of security because their GFR remains above 60, which is often labeled as normal or mildly decreased on lab reports. However, GFR is what we call a lagging indicator. It tells you what has already happened, not what is happening right now. By the time your GFR significantly declines, you may have already lost more than 50% of your total kidney function. This is due to a biological phenomenon known as hyperfiltration. When some of your nephrons become damaged and stop working, the remaining healthy nephrons compensate by working twice as hard. This keeps your GFR looking stable on paper, but it is effectively burning out your remaining healthy filters at an accelerated rate. Think of it like a 4-cylinder car engine where 2 cylinders have failed. The remaining 2 cylinders might still be able to push the car at 60 miles per hour, but they are under extreme heat and pressure, and they will eventually explode if you don't fix the underlying issue. Albumin in your urine is the smoke coming from that engine before it catches fire. A clinical study published by the American Society of Nephrology emphasizes that albuminuria is a much more sensitive and earlier predictor of kidney failure and even cardiovascular events than GFR alone. For seniors over 55, this is critical because your kidneys naturally lose some function with age, making every remaining nephron incredibly precious. Ignoring foamy urine or a slight puffiness because your GFR is still in the green zone is like ignoring a small leak in a dam just because the water level hasn't dropped yet. Eventually, the structural integrity of the dam will fail. Scientific data from the CKD Prognosis Consortium has shown that as albumin levels rise, the risk of progressing to end-stage renal disease increases exponentially, even in people with a high GFR. This is why you must demand a specific test that looks at the microscopic integrity of your filters, rather than just the overall volume they are processing. To take control, you need to know how to interpret the golden standard of kidney testing. Let us look at the specific numbers of the ACR test so you can understand exactly what your body is trying to tell you before the next lab visit. To truly protect your kidneys, you must move beyond the basic urinalysis and focus on a specific measurement called the ACR, or albumin, to creatinine ratio. In the past, doctors often relied on a 24-hour urine collection, which was cumbersome and prone to errors. Today, the medical community has shifted to the ACR test because it is significantly more accurate and can be performed with a simple random urine sample. This test compares the amount of albumin in your urine to the amount of creatinine, which is a waste product that healthy kidneys filter out at a constant rate. By creating this ratio, the test can account for how concentrated or diluted your urine is, giving you a precise health score for your glomerular filters. When you receive your lab results, there are 3 critical ranges you need to remember. A normal and healthy CR is generally considered to be if your score falls into this range, your filters are still structurally sound and holding back protein effectively. However, if your score is between 30 and 300 milligrams per gram, you have reached a stage called microalbuminuria. Think of this as a yellow alert. Your filters are starting to leak, and while the damage is often invisible to the naked eye, it is happening every second of every day. If your ACR climbs above 300 milligrams per gram, you have entered macroalbuminuria, or the red alert zone. At this level, the leakage is significant, and your risk for a rapid GFR decline increases dramatically. According to clinical guidelines from the National Kidney Foundation, the best time to take this test is with your very first urine of the morning. This sample is the most concentrated and provides the most reliable snapshot of your kidney's integrity after a night of filtration. It is also important to note that certain factors like heavy exercise, recent infections, or extremely high blood pressure can temporarily spike your albumin levels. This is why most nephrologists will look for at least 2 positive results over a period of a few months before confirming a diagnosis of chronic kidney disease. Understanding your ACR gives you a clear target to aim for, but it also raises a vital question: why are these filters leaking in the first place? To fix the leak, we must identify the hidden forces that are punching holes in your nephrons. Let us look at the 3 primary culprits that drive albumin leakage and how they silently sabotage your renal health every single day. Identifying why your kidneys are leaking protein is the most critical step in stopping the progression of stage 3 disease. The first and most common culprit is silent hypertension, specifically high pressure, within the glomerulus itself. Many people believe that as long as their arm blood pressure is somewhat stable, their kidneys are safe. However, the pressure inside the tiny capillaries of the kidney can be much higher than the pressure measured on your arm. This internal force literally stretches the filtration slits, making them wider and allowing albumin to escape. According to the Journal of the American Society of Hypertension, even borderline high blood pressure can cause significant protein leakage in older adults because their vascular walls are less flexible, meaning every heartbeat hits the nephrons with more intensity. The second culprit is elevated blood sugar, even if you are not fully diabetic. High glucose levels in the blood lead to the formation of harmful compounds called advanced glycation end products, or AGEs. These compounds act like a biological glue that coats and stiffens the delicate filters of your kidneys. As the filters become stiff and scarred, they lose their ability to selectively hold back protein. For those in the pre-diabetic range, this process happens slowly and invisibly for years. Research from the American Diabetes Association highlights that chronic hyperglycemia is the leading cause of glomerular basement membrane thickening, which is the structural change that precedes a massive drop in GFR. The third often overlooked cause is systemic inflammation and a diet high in ultra-processed foods. When your body is in a state of chronic inflammation, your blood vessels become leaky throughout your entire system, including your kidneys. Foods high in chemical additives and hidden phosphorus create an acidic environment that irritates the renal tubules. This irritation triggers an immune response that further damages the filtration barrier. It is a combined assault of pressure, sugar, and inflammation that eventually leads to the foamy urine and puffiness you see in the mirror. The good news is that these filters are not just passive strainers, they are living tissues that can be protected and in some cases rehabilitated. If we can remove the stressors causing the holes, we can effectively patch the leak and stabilize your kidney function. But how do we actually do that in our daily lives? Let us transition from the causes to the solutions and explore the specific strategies you can use to repair your biological filters and stop albumin from escaping once and for all. Repairing the integrity of your kidney filters is not about a single miracle cure, but a series of targeted lifestyle adjustments that allow your nephrons to heal. The most powerful tool at your disposal is strict blood pressure management. For anyone seeing albumin in their urine, the goal is often more aggressive than for the general population. Clinical guidelines from the Kidney Disease Improving Global Outcomes Organization suggest a target blood pressure of less than 130/80 for those with protein leakage. Lowering this pressure is like turning down the faucet on a leaking pipe. It immediately reduces the mechanical force tearing at your glomerular slits. This gives the delicate basement membrane a chance to recover and prevents the formation of new scar tissue. The second essential strategy is a deliberate shift in your protein sources. As we have discussed in previous sessions, animal proteins are highly acidic and increase the internal pressure of the kidney filters. By transitioning to high-quality plant proteins like tofu, lentils, and chickpeas, you significantly reduce the metabolic workload on your kidneys. A landmark study published in the Journal of Renal Nutrition found that patients who reduced their intake of red meat and increased plant-based proteins saw a measurable decrease in urine albumin levels within just a few months. This is because plant proteins do not trigger the same hyperfiltration response, effectively acting as a patch that stops the protein from spilling out. Thirdly, you must work closely with your medical team to discuss kidney protective medications. Many doctors prescribe a CE inhibitors or ARBs, not just for general blood pressure, but specifically because they dilate the exit blood vessel of the kidney filter. This uniquely lowers the pressure inside the filter itself, regardless of your arm blood pressure. Newer classes of medications, such as SGLT2 inhibitors, have also shown incredible promise in clinical trials for reducing albuminuria and slowing GFR decline. These interventions, combined with a low-sodium alkaline-forming diet, create a powerful synergy that can stabilize your ACR levels and protect your GFR for the long term. By taking these steps, you are moving from a state of passive observation to active defense. You are no longer just waiting for your GFR to drop, you are proactively closing the holes in your filtration system. Now that you understand the science and the strategies, let us bring everything together so you can start protecting your kidneys with your very next decision. It is time to turn this knowledge into a concrete action plan for your future. Today, we have uncovered the truth about why urine albumin is your most critical early warning system. We learned that relying solely on your GFR is like checking the fuel gauge while ignoring a leak in the gas tank. By monitoring your ACR score, managing your internal glomerular pressure, and shifting toward kidney-friendly plant proteins, you can effectively patch the microscopic holes in your filters. Remember, catching an albumin leak today is the key to preventing a GFR collapse tomorrow. You must act on this information immediately. Kidney problems often progress silently, and by the time severe symptoms appear, the internal damage may already be difficult to manage. That is why starting today matters. Every day you delay addressing a protein leak is another day your nephrons are subjected to scarring and inflammation. Your kidneys do not have a reset button, but they do have a remarkable capacity to stabilize if you intervene before the damage spreads. I want you to feel empowered. Managing kidney health can feel overwhelming, but you are fully capable of turning the tide. You are not just a passenger in your health journey, you are the driver. By making small intentional changes to your diet and monitoring your lab results, you can protect your longevity and your quality of life. Your next step is simple. Find your most recent lab report and look specifically for the ACR or microalbumin level. If you do not see it, call your doctor today and request a urine ACR test for your next visit. Please remember that this content is for educational purposes only and does not replace professional medical advice. Always consult your nephrologist before changing your medications or making major dietary shifts. If you found this information life-saving, please subscribe to Kidney Health 365 and hit the notification bell. To deepen your understanding, watch our next video, Low GFR Explained, when creatinine levels are a real warning, not just aging. Let us keep your kidneys strong together.